Let's discuss phase diagnosis, zones 2. Kidney zone. Directly beneath the temples to the line linking both the ear lobes. If this part has blood streaks, acne, or skin spots, it means that the person has a kidney deficiency or is manifesting tiredness, soreness, and pain of the back or lower back. If large, deep skin spots appear here, the person is likely to have kidney stones. If there are moles or warts, it suggests that the person suffers from a congenital deficiency of the kidney function and is manifesting soreness and pain in the back, lower back, and legs. Next, the bladder zone, the base of the nose on both sides of the phlegm. If this part is red or has blood streaks, acne, abscesses, or other imperfections, means that the person has a bladder inflammation. Associated symptoms are brownish urine, frequent urination, and soreness or pain in the lower back. When a woman has a bladder inflammation, it is usually caused by gynecological issues. However, if the base of the nose looks red, but there is no symptom of frequent urination or urgency of urination, coupled with redness of the whole bridge of the nose, this may point to rhinitis. Next, the spleen zone, the nasal tip. If this part is reddish or swollen, or the person has rhinopema, these are signs of spleen heat or the swelling of the spleen. Associated symptoms are headedness, aching cheeks, and irritability. If the nasal tip looks yellowish or pale, it points to the deficiency of the spleen, manifesting symptoms such as profuse sweat, aversion to wind, weariness of the limbs, fatigue, or loss of appetite. Next, the stomach zone. It is the sides of the nostrils. If this appears reddish, it suggests stomach fire, manifesting in such symptoms as excessive hunger and bad breath. If blood streaks become pervasive, it warns the possibility of gastritis. If they look bluish-gray, it indicates stomach coldness. If they appear blue and withered, accompanied by a constant prolonged stomach ache, means the person has atrophic gastritis. If the sides of the nostrils are thin with deep furrows, it could suggest atrophic gastritis. Next, the small intestine zone, beneath the cheekbones on the medial side. If this part has red streaks, acne, skin spots, moles, or warts, it indicates poor small intestinal absorption, causing the person to look physically thin and weak. Next, the large intestine zone, beneath the cheekbones on the lateral side. If this part has blood streaks, acne, skin spots, moles, or warts, it is indication of defecation dysfunctions of the large intestine, and the person tends to experience dry stool, constipation, or loose stool. If this part has crescent-shaped skin spots, it means the person is susceptible to constipation or has hemorrhoids. Next, the reproductive system zone, the phlegm and around the lips. If a female has moles or warts below the lips and her chin looks reddish, but the kidney zone is smooth and clean, it usually indicates that this person experiences soreness and pain on the lower back. If a female has moles or warts around her lips, or the area surrounding her lips appears bluish, black, or pale, accompanied by abnormalities in the kidney zone, it often means that the person is rigid. If a woman has a mole in the phlegm, it points to problems with the uterus. If a man has a mole or warts above his lips with abnormalities in the kidney zone, it suggests problems with his reproductive system. If a male in his 40s and above has a thicker upper lip, that means he may have an enlarged prostate. If he has a recurrent acne on his lips, it means that he has prostatitis. A man whose upper lip is not smooth and has furrows on it may have problems of sexual dysfunction. Thank you for your attention.
We discuss insomnia, etiology, and pathology for interviewing. So what we see on the slide is the etiology and pathology of insomnia. So we have both deficiency and excess conditions. Worry can actually cause a deficient heart and spleen. So this will lead to blood deficiency, thereby causing insomnia. Overwork will make the heart chi very deficient and the kidney. So you will have yin deficiency leading to insomnia. And we have the gallbladder, like a person who is timid may have issues with the heart and gallbladder called heart gallbladder deficiency. And this can lead to chi deficiency leading to insomnia. A woman who is given childbirth will sometimes have heart liver deficiency and thus bringing about blood deficiency leading to insomnia. For excess patterns, worry can actually aggravate or affect the heart, leading to heart or agitate the heart rather. So this will lead to heart fire. Anger will affect both the heart and liver, leading to liver fire. The diet can affect the stomach and the heart, leading to phlegm heat, and wind heat will give us residual heat. So all of this will lead to insomnia. To summarize, the main patterns appearing in insomnia are heart blood deficiency. We have insomnia with difficulty in falling asleep, palpitations, pale tongue, choppy or fine pulse. Deficiency of qi and blood of the spleen and heart. The insomnia will be accompanied by difficulty in falling asleep, palpitations, tiredness, pale tongue, choppy pulse. Heart yin deficiency, there is insomnia with difficulty in falling asleep, palpitations, tongue without coating, floating empty pulse. Liver blood deficiency, insomnia with difficulty in falling asleep, dreaming, dizziness, blurred vision, pale tongue, choppy or fine pulse. With liver yin deficiency, insomnia with difficulty in falling asleep, dreaming, dizziness, blurred vision, dry eyes, tongue without coating, floating empty pulse. Heart and kidney yin deficiency, insomnia with difficulty in falling asleep, dizziness, tinnitus, tongue without coating, floating empty pulse. Heart and kidney yin deficiency with heart empty heat, insomnia, waking up frequently during the night, anxiety, night sweating, dizziness, tinnitus, red tongue without coating, floating empty, and rapid pulse. For gallbladder and heart deficiency, easily awakened at night and easily startled with difficulty in going back to sleep or apt to wake up early in the morning, depression, timidity, hypochondrial discomfort, palpitations. Liver fire, the insomnia will also have excessive dreaming, restless sleep, propensity to outbursts of anger, headaches, red tongue with redder sides and dry yellow coating, wiry rapid pulse, phlegm fire harassing the heart, restless sleep, insomnia, dream disturbed sleep, sputum in the throat, red tongue with redder tip and a sticky yellow coating, slippery, overflowing rapid pulse. Heart fire is characterized by restless sleep, dream disturbed sleep, palpitations, agitation, red tongue with redder tip and yellow coating, overflowing rapid pulse. Residual heat in the diaphragm would mean restless sleep, prefers to sleep propped up, inability to fall asleep, mental restlessness, a feeling of oppression of the diaphragm, red points in the front or around the center of the tongue, slightly rapid pulse. So for treatment, for blood or yin deficiency of the heart, spleen, or liver, we use Shen or heart 7, Ren 15, Du 24, spleen 6. For yin deficiency with empty heat of most organs, but especially heart, liver, or kidney, heart 7, Ren 15, Du 24, spleen 6, Ren 4, kidney 3. Full heat of the heart, liver, or stomach, We have phlegm fire of the stomach and or heart. The points are heart 8, stomach 44, LI 11, stomach 40. Empty heat, heart, liver, or kidneys, heart 6, kidney 3, heart 7, REN 4, spleen 6, REN 15. For retention of food, REN 12, REN 10, stomach 44, stomach 40, spleen 4. Gallbladder and heart deficiency, we have gallbladder 40. Thank you for your attention.
Let's discuss the 5-phase theory, the therapeutics. Walks in. 5 phases in therapeutics. As we have seen, disease of one viscous may affect other viscera according to the engendering and controlling cycles of the 5 phases. Therefore, a certain pathological conditions are deemed to be the result of an imbalance between 2 or more viscera, as opposed to only the imbalance of one viscous. This is borne out in clinical practice by the clusters of associated symptoms and signs that often occur together and which are associated with the specific conditions in TCM diagnostic theory. It follows that treatment should focus on regulating these relationships. In some cases, this means to treat the affected organ phase system. However, a therapeutic strategy using the mother-son relationship is considered very effective, as the adage goes, in case of deficiency, tonify the mother; in cases of excess, drain the son. There are common examples of this in clinical practice, such as tonifying kidney yin in order to help resolve a deficiency of liver blood. But the majority of 5-phase-based treatment strategies used in modern TCM practice involve the use of a special group of acupuncture points known as the transport shoe points. Each of the acupuncture channel is associated with either a viscous or a bowel, and with one of the 5 phases. In addition, each of the channel has 5 points located in its most distal locations, which are associated with 5 phases, the 5 transport points of the young channels. So here we have the gallbladder, which is the wood. The jingwell, the metal, is GB44. Ying spring, the water, GB43. Shoe stream, the wood, GB41. Jing river, the fire, GB38. And the hesi, the earth, GB34. For the small intestine, fire, the jingwell is small intestine 1, spring, Ying spring, small intestine 2, Shoe stream, SI3, Jing river, SI5, Hesi point, SI8. For the Sanjiao, the fire, the jingwell is Sanjiao 1, the Ying spring, Sanjiao 2, Shoe stream, Sanjiao 3, and the Jing river, Sanjiao 6, and the Hesi is Sanjiao 10. For the stomach, the earth, the jingwell is stomach 45, Jing spring, stomach 44, Shoe stream, stomach 43, Jing river, stomach 41, the Hesi, stomach 36. For the large intestine, the jingwell is Li1, Jing river, Li2, Shoe stream, Li3, Jing river, Li5, the Hesi, Li11. The bladder, water, the jingwell is bladder 67, Ying spring, bladder 66, Shoe stream, bladder 65, Jing river, bladder 60, and the Hesi, bladder 40. The 5 transport shoe points of the yin channel, the liver for the wood, the jingwell is Li1, Ying spring, Li liver 1, the Ying spring is liver 2, Shoe stream is liver 3, Jing river is liver 4, and the Hesi is liver 8. For the heart, the fire, the jingwell is heart 9, Ying spring is heart 8, shoestring, heart 7, Jing River, heart 4, and the Husi is heart 3. For the pericardium, the fire, Jingwell is PC9, Ying Spring PC8, Shoestream PC7, Jing River PC5, the Hussey is PC3. The spleen, Earth, the Jingwell is spleen 1, Ying Spring spleen 2, Shoestream spleen 3, Jing River spleen 5, the Hussey is spleen 9. For the lung, the metal, the Jingwell is lung 11, Ying Spring lung 10, Shoestream lung 9, Jing River lung 8, the Hussey is lung 5. For the kidney, water, the Jingwell is kidney 1, Ying Spring kidney 2, Shoestream kidney 3, Jing River kidney 7, the Hussey is kidney 10. Thank you for your attention.
Hepatomegaly. Let's go to differential diagnosis, Western and CM. The topic is abdominal mass. Western differentiation of abdominal masses and distension. Number 1 is stemming from liver pathology. Hepatomegaly, it's a smooth mass below the right ribs. And there's also liver cancer, which is a firm, lumpy mass below the right ribs. The number 2 is stemming from gallbladder pathology. It's acute cholecystitis, where there is tenderness, sometimes with a mass below the liver in the right upper quadrant. Number 3 is stemming from kidney pathology. Hydronephrosis, it's smooth, spongy mass inside or back. There's a cyst also, which is a tender mass on the flank, and there is pain. With kidney cancer, smooth, firm, non-tender mass near the kidney. And number 4 is stemming from stomach pathology. Stomach cancer, there is mass on the left upper or central abdomen. There's appendicitis, where there's vague pain around the navel, developing into sharp, severe pain in lower right abdomen. Number 5 is stemming from spleen pathology, where there's spleen enlargement or splenomegaly, which is an abdominal mass in the left upper quadrant. Number 6 is stemming from intestinal pathology. 1 is irritable bowel syndrome, where there's abdominal distension with alternating diarrhea and constipation. And there's fecal impaction, where there's abdominal mass on the left lower quadrant. There's colorectal cancer, where there's the location is variable. Crohn's disease is bowel fibrosis causing multiple tender sausage-shaped masses in the abdomen. Diverticulitis is mass usually on the left lower quadrant. And number 7 is stemming from bladder pathology, where there's bladder distension. It's a firm mass on the center lower abdomen. Number 8 is stemming from ovarian and uterine pathology. There's ovarian cyst, where there's smooth, rounded, rubbery mass above the pelvis in the lower abdomen. There's also uterine fibroid, which is an abdominal mass with sensation of pressure. In Chinese differentiation, let's look at the abdominal masses and distension in Chinese differentiation. So the diagnostic questioning according to number 1, 8 principles or 6 divisions. It says internal, there's spleen Qi deficiency, retained pathogen, that is damp phlegm, damp heat. Is external, it's wind invasion that blocks the lungs, spleen, and the Qi and tie-in. Number 2 is Qi, blood, and body fluids. It's Qi and blood stasis, water accumulation, food stagnation, retention of phlegm and damp, Qi obstruction causing constipation. Number 3 is location of mass or distension. It's the upper and lower abdomen or the umbilicus groin region, just the region below the heart and the hypochondrium. Number 4 is digestive and gynecological. It will be according to the symptoms. Number 5 is nature of abdominal mass. It's fixed, substantial, painful, usually with its blood stagnation. It comes and goes, changes location, movable, like Qi stagnation, soft on palpation, and no pain. And that's for phlegm. Number 6, nature of distension. Comes and goes, changes location, soft on palpation, no pain, fluid retention, just spleen Qi deficiency. Number 7, etiology. Emotional strain, like repressed anger, frustration, resentment. There's poor diet, irregular eating, excessive cold, greasy foods. External pathogenic factors, that is external cold and external dampness invading. Number yin and yang deficiency. Number 9, Zangfu patterns with masses. So there's qi masses, which is stagnation of liver qi, retention of food in stomach, phlegm obstructing middle burner. And there's blood masses, which is blood stasis in stomach, liver blood stasis in the uterus, and cold in the uterus. Number 10 is Zangfu patterns with distension. Spleen and stomach qi, yin or yang deficiency, retention of damp phlegm or damp heat. Thank you so much for your attention.
We discussed Zang viscera. This time we focus on the liver function, storage of blood. The liver is located underneath the diaphragm on the right side behind the ribs. Its meridian connects it to the gallbladder, with which it forms an interior-exterior relationship. The liver is one of the most important organs in the body. Its main functions are storage of blood, regulation of the total quantity of circulating blood, regulation of the emotions, promotion of the circulation of qi and blood, promotion of the metabolism of fluids, and regulation of menses. The ancient physicians grouped these functions in two broad categories, that of storage of blood and that of conduction and facilitation. The liver has the capacity to store blood and to regulate the volume of circulating blood. Blood is generated from the essential nutritive substances of drink and food, transported and transformed by the spleen and the stomach. Following generation, a portion of the blood is placed in circulation to convey nourishment to the entire body, and another portion is placed in storage in the liver. Thus, the liver is the principal organ for the storage of blood. It is essential that there is a reserve store in the liver should there be need for additional food. Under general conditions, the volume of blood in circulation through the viscera, the tissue, and the other organs of the body is relatively constant, but it must respond to changing requirements depending upon the body's functional state and to the influences of changes in the weather so that it may be regulated appropriately. For example, when a person is at rest or asleep, the requirements of the various organs and tissues are reduced, and a portion of the blood is removed from circulation by the liver for storage. During physical activity or when the person is under emotional upheaval, the requirements for blood are increased. The liver now releases its stored blood to enter the circulation. Because it has this function of storing blood and the ability to regulate the volume of blood in circulation, the liver is the sea of blood. The functional activities of all parts of the body are closely linked to the liver. This function of the liver in storing blood manifests two principal types of pathological changes. The first type is due to insufficient stores of blood, so that the amount of blood in circulation cannot meet the requirements of the body. This may give rise to dizziness, blurred vision, night blindness, numbness in the limbs, oligomenorrhea or decreased menses, and even amenorrhea, cessation of menses. The second type is due to the liver not storing unneeded blood, leading to bleeding of various types, such as hematemesis or vomiting of blood, hemoptysis, coughing of blood, epistaxis, nosebleed, metrorrhagia, heavy uterine bleeding, metastaxis, slight uterine bleeding. Thank you for your attention.
Let's discuss diagnosis according to Zangfu organ patterns. The phlegm obscuring the Shen. Where the previous patterns manifest with both physical and mental symptoms and signs, these and the following patterns are much more mental-emotional in their manifestations. Etiology. Diet is often a major factor in the formation of phlegm. This can also be the case here, where consuming damp and phlegm-producing foods and foods that have a cold or hot energy can lead to the formation of dampness or phlegm. Chronic emotional imbalances can stagnate hard qi and lead to phlegm obscuring the Shen. Heat conditions can condense fluids and thereby create phlegm. Chronic yang deficiency and blood stagnation can lead to fluids accumulating and forming phlegm. Certain medicines can create phlegm that then obscure Shen. Phlegm obscuring Shen may be a congenital pattern in children. For the symptoms and signs, there is mental confusion, slow thinking and comprehension, blurred, foggy sensation in the head, as if it is full of cotton wool, heavy sensation in the head, loss of consciousness, mental fatigue, difficulty concentrating, forgetfulness, depression, dull, matte eyes, inability to maintain eye contact. The person seems absent and not fully present, incoherent speech, talks nonsense or has difficulty formulating sentences, muttering or talking to themselves. The voice may be slurred, difficulty maintaining a structure in their lives, lack of motivation, increased need to sleep, nausea, heavy breathing or wheezing, rattling sound in the throat, vomit of sputum in extreme cases, swollen, flaccid tongue, possibility with greasy coating, slippery pulse. The key symptoms, there is mental confusion, foggy sensation in the head, difficulty concentrating, swollen tongue with greasy coating. For the treatment principle, transform phlegm, open the heart. For the acupuncture points, choose from stomach 8, stomach 40, do 20, pericardium 5, stomach 36, REN 12, REN 14, UB 15, UB 20. If there's loss of consciousness, we use heart 9 and do 26. Needle technique is draining except on REN 12, stomach 36, UB 20. For the explanation, stomach 8 and do 20 drains phlegm from the head and brightens the Shen. Pericardium 5, stomach 40, REN 14, UB 15 transform phlegm in the heart and brighten the Shen. Stomach 36, REN 12, UB 20 transform phlegm. Do 26 and heart 9 revive consciousness. Relevant advice, the patient should avoid eating a diet that is damp and phlegm producing. They should ensure that they get a lot of fresh air and physical activity, as there is often a significant emotional aspect linked to this pattern. They should also try, whenever possible, to address the underlying emotional themes. Phlegm obscuring the Shen can be caused by heart qi stagnation, spleen qi deficiency, damp, phlegm, heat conditions, blood stagnation, yang deficiency. Phlegm obscuring the Shen can result from phlegm, heat in the heart, blood stagnation, spleen qi deficiency. Phlegm misting the mind, the etiology, excessive consumption of phlegm-forming foods, severe emotional problems, underlying or accompanying pathology, spleen qi deficiency, dampness and phlegm, heart qi deficiency, heart blood deficiency. For the signs and symptoms, there is mental confusion, unconsciousness, lethargic stupor, rattling coming from the throat, vomiting, speech difficulty. The pulse is slippery. Tongue, swollen tongue with thick, sticky, slippery coat. Deep midline crack reaching the tip. For the treatment principle, transform phlegm, open the orifices of the heart, and restore consciousness. For the acupuncture treatment, heart 9 clears heart, opens the orifices. Bladder 15 clears the heart, supplements heart qi. Do 26, restore consciousness. Needle with draining. REN 12 supplements spleen qi. Needle with even method. Pericardium 5, phlegm from the heart. Stomach 40 resolves phlegm. Bladder 20 supplements spleen qi. Thank you for your attention.
Let us go to etiology in Chinese medicine. Introduction. The human body is an organic whole. At the same time, there is an intimate relationship between the human body and its environment. This relationship is one of dynamic balance, opposition, and unity between the internal environment of the body and its external environment. It is by maintenance of this dynamic balance that the body's vital activities are assured. Should this dynamic balance be disturbed for any reason and the body unable to restore it spontaneously, illness can result. The factors that lead to such disturbances are the cause of illnesses. There are many causes of illnesses in CM. Examples include unusual climatic conditions, contagious pestilence, inappropriate diet, fatigue or exhaustion, passion, traumatic injury, and injury by animals and insects. In order to comprehend the nature and pathogenic characteristics of these causes, ancient physicians made a number of attempts to classify them. The internal classic was the first to classify causes of illness by yin and yang. Thus, the plain question states, disease-causing or pathogenic evils are born of either yin or yang. Those born of yang derive from wind, rain, cold, or heat. Those born of yin derive from inappropriate drink and food or improper living accommodations. Joy and rage are also yin and yang, or yang. The Han Dynasty physician Zhang Zongjing pointed out in the Essentials from the Golden Chest that there were three mechanisms for illness to develop. The 1,000 illnesses can all be subsumed in three groups. The first group comprises interior illnesses caused by external evils attacking the meridians and invading the Zangfu viscera. The second group comprises exterior illnesses caused by blockage of meridians, hence blood stasis in the forelimbs and 9 orifices. The third group comprises injuries caused by intemperate sexual activity and wounds from weapons, animals, and insects. All causes are accounted for by this classification. The Song Dynasty physician Shen advocated the theory of three causes, namely external causes by invasion by the climatic pathogenic evils, the internal causes is injury by the passions, and causes that are neither external nor internal, like inappropriate diet, exhaustion, trauma, animal, and insects. These classificatory attempts by the ancients to combine pathogenic factors and the courses of illnesses are highly significant in clinical diagnostics. In CM, there is no illness that does not have a cause. Every illness reflects the body's response to its causative factor and its actions. In the course of any illness, cause and effect interact, so that what may be an effect at one phase may in another be a cause. Phlegm accumulation and blood stasis, for example, are effects of dysfunction of qi and blood of the Zangfu viscera, yet they can induce certain pathological changes. In addition to understanding the nature and properties of the causes of illness, the study of etiology is mainly the attempt to determine the natural course of illness on the basis of clinical manifestations. This approach is known in CM as seeking the cause through syndrome analysis. Thus, the study of etiology in CM attends not only to the nature and pathogenic characteristics of the causes of illness, but also the clinical manifestations they induce. In this way, it provides the basis and guide for treatment and herbal prescription. Thank you so much for your attention.
Let's now proceed to the third part of the overview in our topic, the emotions. The emotions and the 5 elements. The element wood is related to or ascribed to the emotion anger, and its organ is the liver. The element fire is related to emotion joy, and its organ is the heart. The element earth is related to the emotion pensiveness, and its organ is the spleen. Metal is its emotion is worry, and its organ is the lungs. The element water has fear as its emotion, and its organ is the kidneys. Although its emotion affect a particular yin organ selectively, the relationship between a given emotion and a particular organ should not be interpreted too rigidly. Each emotion can and does affect more than one organ, and often in a pattern that does not follow that of the 5 elements. This will be explained more in detail later. Passages of spiritual access and simple questions confirm Dr. Zhang's ideas. For example, with regard to excess joy, chapter 8 of the spiritual access says, excess joy of the lungs injures the corporeal soul, and this may cause manic behavior. With regard to anger, chapter 23 of the simple question says, when the gallbladder is diseased, anger. Chapter 62 of the simple question says, when blood rushes may cause anger. Chapter 8 of the spiritual axis says, anger affecting the kidneys injures the willpower or G. With regard to pensiveness, chapter 39 of the simple question says, pensiveness makes the heart Chi accumulate, causing the mind to stagnate. The upright Chi settles and does not move, and therefore Chi stagnates. With regard to worry, chapter 23 of the simple question says, when Chi rushes upward, it affects the liver, causing worry. Chapter 8 of the spiritual axis says, worry of the spleen injures the intellect. With regard to fear, chapter 4 of the spiritual axis says, worry and fear injure the heart. Chapter 62 of the simple question says, when blood of the liver is deficient, there is fear. Chapter 19 of the simple question says, fear makes spleen Chi stagnate. Chapter 23 of the simple question says, when stomach Chi rebels upward, there is vomiting and fear. Chapter 8 of the spiritual axis deals with the mental effect of the emotions in detail. It says, the method of healing should first of all be rooted in the mind, or Shen. Blood vessels, nutritive Qi or Yin Qi, and Qi and the spirit or Jing Shen are stored in the 5 yin organs. When they are out of harmony due to the emotions, the essence or Jing is lost, the ethereal soul or the Hun, and the corporeal soul or the Po are scattered. The willpower, G, and the intellect, E, are chaotic, and the person lacks wisdom and reflection. Why is that? Heaven bestow us virtue, or the earth bestow us Chi. When virtue flows and Chi pulsates, there is life. When the two essence of mother and father unite, the mind comes into being. What follows the mind in its coming and going is the ethereal soul. What follows the essence in its entering and exiting is the corporeal soul. The heart directs mental activities. It houses memory that is called intellect or yi. The storing of data of the intellect is called willpower or memory or ji. Willpower generates pensiveness, and pensiveness generates reflection. Thus, the wise nourish life, or the yang shen, by following the 4 seasons, adapting to cold and heat, moderating joy and anger, regulating yin and yang, and thus will enjoy long life. Fear, pensiveness, and worry injure the mind and spirit. When the spirit is injured, fear may run wild. When sadness agitates inside, it injures life. Joy scatters the spirit out of its residence. Worry obstructs Chi so that it stagnates. Anger causes loss of self-control. Fear sweeps the spirit away. Fright and pensiveness of the heart injure the spirit. Worry of the spleen injures the intellect. Sadness of the liver injures ethereal soul, which may cause manic behavior and mental confusion. There is contraction of the sinews. The hypochondrium cannot be raised. The hair withers. The joy of the lungs injures the corporeal soul. When the corporeal soul is injured, there is manic behavior, and the yin cannot reside. The skin becomes like heated leather. The hair withers. Anger of the kidneys injures the willpower, and the willpower is injured. It affects the memory, and one does not remember what they said. There is lower back ache and inability to bend or extend the back. The hair withers. Fear injures the essence. This injures the bones. Thus, the 5 yin organs that store the essence should not be injured. If they are, yin deficiency results, and from this, qi deficiency. Therefore, when needling, one should observe the patient in order to know the condition of the essence, mind, ethereal soul, corporeal soul, and whether they have been preserved or not. The liver stores blood, and blood houses the ethereal soul. When liver chi is deficient, there is fear. When full, anger. The spleen stores nourishment, and this houses the intellect. When spleen chi is deficient, the four limbs are weak, and there is an imbalance in the five yin organs. When full, there is abdominal distension and menstrual and urinary problems. The heart stores the blood vessels, and this houses the mind. When heart chi is deficient, there is sadness. When full, incessant laughter. The lung stores chi, and this houses the corporeal soul. When lung chi is deficient, there is nasal obstruction. When full, breathlessness and a feeling of tightness of the chest. The kidney stores the essence, and this houses willpower. When kidney chi is deficient, there is collapse. When full, the tension and the five yin organs are not at peace. Thank you for your attention.